Hello and welcome back to my channel. Today we are talking about something that can be a little bit of a sticky topic in the lactation world, and that is nipple shields. As someone who has been working in the field of lactation for almost 10 years now, this is something that I can say hand on heart is a tool that I use relatively frequently, but I feel like shouldn't get the bad rep that it's or get such a bad rep that it doesn't deserve. Having correct use of a well-fitted nipple shield with support from a lactation consultant to help you get to the root cause of the problem can help you breastfeed your baby. And for me, I'm all about finding ways that I can support mamas to feed their babies. And so certainly it is not like, shouldn't be used like a plaster over a problem. For instance, if your baby has a tongue tie or a poor latch, it should not be a case of let's just use the nipple shield so that we can keep going. But it can be a beautiful tool for someone who has, for instance, very damaged nipples that they are working on healing. If they have a baby that is preterm or early term that struggles to maintain coordination on that suck, swallow, breathe sequence, or struggles to have enough of a seal around the nipple and breast to be able to maintain suction and continue to work to transfer milk. It can also be really nice if you are maybe moving away from a bottle and you're trying to get your baby to the breast. So if you've had a period of breast refusal, or if you are working with a baby who is struggling with that transitional piece from being full-time bottle use and is working on the texture of the breast, and that's something that can help them to just bridge the gap. Anyhow, it gets a lot of bad rap. When used appropriately, there's some evidence that suggests that actually in terms of milk transfer, if the latch is good, the fit is good, there's very little in the difference between how much milk a baby can actually transfer. So I'm a big fan. I think they get a bad rep. That being said, fit is huge. Sizing is huge, and the type of nipple shield that you choose is huge, as well as the way it's applied. So I'm going to talk about how to apply it now in just a moment, but they come in many different shapes and sizes. These are the two main sizes, or main shapes. So they come in small and medium, and they are generally in either a conical, so you can see there it's sort of pointed, so that's conical, or in a cherry shape. Depends on the baby, depends on the reason that we're using it, depending in terms of which shape that I would recommend that you use. But for the instance of this video, I am going to go ahead and show you how to correctly apply a nipple shield using this cherry shape. So we have our lovely breast here. When we're looking at applying a nipple shield, we want it to be well fitted. We want the nipple to take up about 3/4 of the space within the shield, so that baby isn't just sucking mostly on the plastic. We want them to be getting a nice big mouthful of breast tissue. So this is where the way a baby latches onto the breast, even with a nipple shield in place, is so important. So for me, I don't like to put anything on it. A lot of lactation consultants will recommend a bit of lanolin or kind of sticking it on with like a medical grade tape. Sometimes I will recommend dipping it in some warm water to make it really nice and pliable and stretchy, but they're actually, because they're so thin nowadays, they tend to be pretty stretchy anyways. But the way I do it is stretch it out nice and long, place your finger over the top so that you're going to sort of half invert it, almost like a sort of a sombrero hat. And this is a bit tricky with less hands, but nipple central in the cavity, over the nipple shield stretched out still, stretching it out, releasing the suction. So you can see there, it's taking up approximately 3/4, if not a little bit more, of the space within the nipple shield itself. It should remain nice and suctioned. These ones, oh look, it's even staying on. With these ones, they have a sort of a half moon shape. So they generally will come in a half moon shape like this, in which case I love to have the chin where the plastic is and this sort of more open area where the nose is, so that baby can get the benefits of that, of the smell of mum and have that nice skin to skin contact. And if you've got ones that have sort of like wings on either side, making sure that they're really well applied is really important so that it doesn't flip up over baby's face. This was a little demo on how to correctly apply your nipple shield, along with some of the little details around correct usage. Always make sure that if you are thinking about using a nipple shield, that you are working alongside an experienced lactation consultant. I do Zoom consultations around the world, and I also cover the Leinster area here in Ireland. So if you're looking for support, make sure and send me a message or an email, and I would love to help you get on your way.